Good morning. It's good morning. It's Dr. Jenny Tufenkian here with a reminder to love. I'm here to talk to you today about coughs. They are such a drag, and I honestly don't know which is worse. It's like if it's you're the one that's up with the cough or it's a loved one. I certainly remember the nights I would lie in bed awake just listening to my kids cough in the other room, and as a young naturopathic doctor, I'm thinking, okay, which remedy is this? As I'm listening to them cough, trying to figure out. It is so aggravating and horrible to watch others suffer. And then, of course, if it's you, it also is terrible because you're lying there in bed and you can't sleep because you're coughing. Hi, Liz. And you are just really struggling. So there's a couple of different kinds of coughs. We're going to talk about the different kinds of coughs, and we're going to talk about the different oils that you can use to support you depending on what kind of cough is going on with you or the ones that you're taking care of. And then I'm going to share with you some of the just amazing age-old treatments that we've been using in naturopathic medicine and functional medicine to help support the body when it has a cough. So first of all, coughs are crazy common. It's actually one of the number one reasons people go in to see their physician is because of a cough, especially associated with some sort of illness like a virus or a bacterial infection. Unfortunately, this is a place where conventional medicine really doesn't have a whole lot to offer us because a lot of the medications, I just read a peer-reviewed study of a meta-analysis of all the different drugs they use for coughs, and they aren't that impressive, the results. They don't work that well or that consistently. They have a couple different mechanisms of which they can act that we'll talk about a little bit later. But I really think this is a place where, along with lots of other areas, we are so fortunate to have these amazing essential oils that we can use to help us in our health. And essential oils and lifestyle really can move you through the cough stage of some kind of an infection. So there are lots of reasons the body coughs. The cough is like most other things that the body does. It's really the body's attempt to help you. So your body's coughing because it has interpreted some sort of irritation somewhere in the body. So it could be an irritation in the sinus where you've got some postnasal drip. It could actually oddly be an ear thing that's causing you to cough. It could be an irritation in your throat. It can be an irritation inside your chest cavity if there's pressure on the lungs or if there's a tumor or something like that. There can be lots of different reasons why we cough. Also, having esophageal reflux can make you cough. That's a really common reason that not a lot of people know about. It's just sort of a cough that goes on and on and on. It's kind of low grade, it's non-productive. That can be due to GERD. Those are a lot of different reasons for cough. I'm actually not going to go into those in a lot of detail today because really what I want to talk about are the coughs that come along with infections, because that's what we're dealing with this time of year. That's what I'm hearing when I'm in the clinic. That's what I'm hearing from you guys when you're when you're on Facebook and you're posting, what do I do with my kid who's sick? So that's what I want to talk to you about today. So when somebody's sick with a viral or a bacterial infection, it's the body begins to attack that virus or that bacteria with the white blood cells, and it creates these byproducts, these dead cells, and the white blood cells themselves, plus a lot of other stuff that comes out in the form of mucus. You have got to have that mucus or else you would pretty much wither up and die. So mucus is a good thing, but it's easy to feel like you're drowning in your mucus in some situations, or it can feel like a cough is really not very productive. So there's usually two kinds of cough. There's a dry cough, which is that cough where you're coughing all the time. And in the worst situations, this becomes one of those really what we call a spasmodic cough, where you just cough and then 5 minutes later, like that. And you're just doing this over and over again. And I think this is one of the hardest ones when I hear my kids with this one. It's really the most disturbing to me in a way because they just look so frustrated and their little faces get pink and it's really hard. So I want to talk to you about some different oils you can use for a dry cough, or different oils you can also use for what's called a more productive cough. A productive cough is when you actually cough and there is some kind of mucus there. The goal is, frankly, to get to a productive cough that is efficient. So a productive cough that's not efficient is one where you're just swimming in the gunk. You feel like there's a lot of pressure in your chest. You cough and you cough and you cough, and then there's some stuff that finally comes up and you're exhausted after that coughing fit. Can some of you maybe identify with this out there, have it now or have had it in the recent past? So you want to, an efficient productive cough is one where it's a post-viral type of thing and you just cough a few times, it loosens up the mucus, and then you're done. and you go on. You're not having the cough over and over and over again. So there are different oils that can work for different things. So first of all, you want to make sure that you thin down the mucus. And the best way to thin down the mucus is water. Water is the absolute best mucolytic. So, and that's the key word you want to look for is mucolytic. So when you're looking through your reference books on your essential oils, look for the term mucolytic. That means it's going to thin the mucus, which is a good thing to do. That makes it easier for the body to cough or to expel it when it's coughing or when you're clearing your throat. Some of the great mucolytic essential oils, lemon is a fantastic mucolytic. So just drink that quart of water and put some lemon drops in there, and that can be a great way to start getting that mucus to break down. There are some enzymes that are actually really great mucolytics. So you could take your Terrazyme, and that will also help break down your mucus. You can take that on an empty stomach, and that will help break down your mucus. Douglas fir is another one. All the firs are really great for viral or for coughs. So Douglas fir is a great mucolytic, as are rosemary and thyme. So think of those as your mucolytics. Now, the beautiful thing about these essential oils and all plants, when you use plants in any form, when you use them, is they don't just have one function. And again, this is where we're just 10 times more ahead of the game than with a pharmacological agent that usually only has one or two mechanisms of action. So the fact that you're using lemon to decrease the mucus, to thin out your mucus, is great, and it also happens to be antiviral and anti-infective. So it's really supporting your immune system at the same time. It also helps support your detoxification pathways in your liver. So you're able to break down the byproducts of the inflammation as well. So you're hitting so many birds with one stone. Sorry if that's offensive to vegans. I think I need to come up with a different way of saying that. So you want to thin out the mucus for number one. And then if you have that, if you want to increase the expectoration, if you want an expectorant, so that means something that's actually going to help boost up the mucus production and get it so that you can cough it out. Some of the expectorating oils are Ravensara, which is in the Breathe oil, which I'll talk about in a minute. That's such a great combination. doTERRA doesn't have the Ravensara as a single right now. I expect maybe it will at some point in the future, but right now it's a great one in the Breathe. Doug fir, again, is an expectorating, so there again, you're getting the mucolytic and the expectoration. Eucalyptus and thyme, again, thyme is great for so many aspects of a cough. Peppermint and cardamom. Cardamom is another one of those that just hits so many points that you want to hit whenever you have a cough. So it's one to keep in mind as something you might want to use. Things that you want to think about other types of oils that can also bring down some of the pain, like eucalyptus is an analgesic, your birch is an analgesic. Marjoram might be something you want to add into some of your blends because it really helps with pain and inflammation. So if you're really achy and sick with a fever still, some marjoram in any kind of blend that you do might be great. And in a minute, I'll talk about different ways that you can use these oils in different combinations and how to get them into the body for a cough. So an anti-inflammatory aspect to all of this is obviously the body is inflamed when it's sick. And so bringing down that inflammation can really help. Frankincense is just our number one go-to time and time again for inflammation. So add frankincense into your blends, and that will really, really help bring down the inflammation. Cardamom, again, shows up as an anti-inflammatory. And if you guys want some of these oils, I'm happy to write out a little thing that I can send out to you next week. I can put out a link next week to some of the tips that I'm giving you today, because I know I'm giving you a lot of information, and you may not be in a place where you can write it all down. So another thing you want to think about is a decongestant. So that's when you've got like that really clogged up forehead and brain, or you just feels like there's stuff kind of slowly coming down your back of your throat from postnasal drip. A really great way to tell if your headache is a sinus headache or another kind of headache is if you just tip your head down like that. If the pain gets worse, then it's usually due to a sinus pain, and the sinus pain is usually here and here. So really nice decongestants. Peppermint, of course. Ginger is really great. Cardamom, again. Melaleuca is another really great decongestant. So those are all really great. Another thing you might want to think about are antispasmodics, because if you're in that dry cough pattern where you're like that, and it's just spasmodic and it's not doing a thing for you, then think about some oils that might bring down the spasms. So peppermint is a great antispasmodic. So that's a really nice one, and that's why you find it in a lot of cold and flu blends. Arbor Vitae is another one that's really great as an antispasmodic, as is, again, cardamom. So again, as you can see, cardamom keeps hitting point after point after point. You can see why they put that in the breathe oil. The best way to get the oils into your body, there's two different routes that I think are the best when you're dealing with the lungs. Because the lungs take in the air, the lungs have an incredible surface area inside the lungs. So the best way to get stuff in is to actually aerosolize the oils themselves. So this is where your diffuser is such a bonus to have. And you can run the diffuser at night when people are sleeping, or during the day. Just stick yourself or your sick kid in next to the diffuser and have it just run next to them. Another way is to actually do a steam bowl, which is where you take a bowl of hot water and put a few drops of oil, and then you take a towel and you put the towel over your head and over the bowl, and you're creating a little steam bath for your face. This is an amazing treatment and really great if you've got a sinus infection or something going on there. It just really helps get the oil straight into all of the upper respiratory passageways. So some nice oils to put in there would be the breathe oil, would be great to put in there. Eucalyptus is a great one. You could do eucalyptus and cardamom and thyme in there and breathe those. Really, really helpful. Peppermint you could use, but I just am super cautious because doTERRA's peppermint is so wonderful and beautiful and strong that you have to be careful it doesn't get into your eyes, and even steaming the vapors can get into your eyes and it can sting. I would not put peppermint in a child in a hot steam bath, because I would worry it might sting their eyes. And just as a note, if you do ever get essential oils in your eyes, the easiest way to get it out is with the oil. So you can take a cotton ball and put olive oil or coconut oil, almond oil, anything you have that is clean, and just put a little bit on the cotton ball and just wipe your eye. And just usually by 3 to 4 wipes, it's completely gone. Don't use water, because that disperses the oil even more and can make it burn even more. So definitely use oil to get oil out. Like takes care of like. So the other way to get the oils in through aerosolizing is this really cool idea that I actually just learned about. I haven't done it yet, and I want to try it. So if you guys have ever done this, or if you try it, let me know how it goes, is to make a shower melt. It's such a cool idea, and if you guys want, I'll put this in that little information thing I'll get out next week for you. So it's a cup of cornstarch, half a cup of baking soda, and then 20 drops of your oil. So I would use something like lemon and eucalyptus, maybe some peppermint in there. I'd be a little cautious. You could do your cardamom, your thyme. Again, choose the oils that you need based on whether you need mucolytics or expectorants or stimulants, what you need. And then you whisk it together, and you want to put them, you basically freeze little blobs, and then you put them in a silicone tray. And then you take those out when you take a shower, and you put it in the bottom of your shower, and it melts in the shower and it vaporizes. I think it's the coolest idea ever, and such a great treatment if you're sick. So I highly recommend doing that. And again, if you have the aches and pains, I would put the marjoram in there too and see how that helps diffuse some of that achiness that you get when you're sick. I would also suggest putting oils in there that make you feel happy, maybe some wild orange. It's really easy to feel despairing when you're sick. That's due to interleukin-1 and interleukin-6. Interleukin-1 makes you feel depressed. Interleukin-6 makes you feel really anxious. Those increase when you're sick. So adding in wild orange or lemon, some of the citrus oil, some of the fir oils too are really uplifting. So those can be helpful, and I suggest putting those in there as well. The other great way, you can just be your own diffuser for things. So one of the things that I use a lot in the clinic, and I suggest to people with either acute respiratory issues such as coughs after colds and flus, or for people with more chronic breathing issues, is to use their breathe, and they just put a few drops straight in your hand. Just take your breathe oil and drop it in your hand, and then you use your other hand, make it into like a pipe, and you suck in that oil and hold it into your lungs like this, and you can just feel it expand. It's an amazing treatment, and it's super easy. Just carry breathe oil. Now, if you really feel that super tight, congested feeling, add frankincense. And this is like some of the medications that they use for respiratory issues have steroids in them to bring down the inflammation. I consider frankincense our healthy anti-inflammatory type steroid type thing. So if you add a few drops of Breathe and then a few drops of frankincense into your hand, smooth it around, breathe it in, it's incredible the effect that that has. And I really can see that when I give that to people who are really, really tightly congested, and they immediately get relief. This is something you can do frequently if you're feeling sick, like every 1 to 2 hours, you can just go ahead and do this kind of inhalation process as much as you need to. It's great. And that's actually what I put in my diffuser if I have a cough at night, is I put in about 10 drops of Breathe in my diffuser and just let it run throughout the nighttime. A few months ago, my son got sick and he had a cough, and the Breathe just wasn't enough for him. He needed something else. And so I upped that. I added eucalyptus, I added more peppermint, I added more cardamom, and I added some arbor vitae, and that just totally did the trick for him. It just really shifted his cough into a different place. So hopefully that's helpful in terms of beginning to look at some different oils and when you would want to use them. So again, you want to look for mucolytics and thin out the mucus. Look for expectorants to bring up, to have more cough. If you have a dry cough, look to using some of the furs for that. Now, another way that is a great way to apply the oils are to make liniments or rubs. So one way to get it is to breathe, like we talked about. The other is to actually put it directly on the chest or on the spine. So you can take any combination of these oils and add in with a carrier oil, or you can get fancy and look up a recipe for a liniment or a rub and add in the beeswax and the oils and all of that, and make a lovely liniment. That might be a nice thing to do to put in your chest for your healthcare, for your winter colds and flus. That could be great. One of the ideas, I've got a couple little recipes here. Let me see if I can grab them for you. Maybe I can't find them. One of the other ways that is great to use the oils is down the spine. So in a second, I'll come up with the recipes for you for a few little rubs. But when my kids are sick, we always have done hydrotherapy with them. So there's 3 different places to do hydrotherapy when you're not feeling well. So one is to do nasal lavage. So this is using a neti pot, where you neti pot your sinuses and clear them out. You can add essential oils into that. You can add a little bit of frankincense to decrease the inflammation. Do not add any oils that are hot. Like never, never, never add any oregano or lemongrass or any of the hot oils. And you only want to use a little tiny bit of the oil, but you can use a little bit of frankincense in there. It's really nice anti-inflammatory into the sinuses. I recommend using purified water or water that's been boiled for 5 minutes, and you can look up instructions on how to neti pot. Doing that when you wake up in the morning and before you go to bed at night is really going to help relieve a cough, because a lot of coughs are due to postnasal drip coming down and dripping down into the lungs while we sleep. If you wake up in the morning, you're like really feeling crummy, that's usually due to postnasal drip. So if you do the nasal lavage, that's going to help a bunch. The other thing I love to have people do is something called warming socks. And this is where you get your feet, you need a pair of cotton socks and a pair of wool socks. You get your cotton socks cold and wet. Yeah, I know it sounds absolutely insane, but this is exactly what you need to do. You take your cotton socks, you get the feet cold and wet in the water, wring them out really well. And then this is the very last thing you do before you go to bed. You stand in a bucket of hot water, take a hot bath or a shower, get your feet toasty hot, and put on those cold, wet cotton socks, on your hot feet, and then cover them up with dry wool socks and go straight to bed. You do not brush your teeth. You've already done all that. You just go straight to bed. What happens is your body feels the cold and drives all the blood up into your central organs. And then it realizes that actually you're probably not going to die from these cold feet, and it begins to put blood back down into your feet. And this process continues as you're sleeping. You get increased circulation throughout your sleeping, and it increases your white blood cell production, so you have more immune fighting agents in your body. The thing that I would suggest doing is you supercharge your wet socks. So supercharge wet or warming socks by putting some essential oils on your feet so get out of the hot tub, and then rub some On Guard on the bottom of there, or put some Breathe or some cardamom or some thyme down on the bottom of your feet, and then put your socks on. And then you're going to supercharge your warming socks. There's another protocol that we do called a constitutional hydrotherapy. And again, if you're interested, I can give you some handouts on how to do this. But this is what I did with my kids. I happen to have, my oldest son had terrible time with lung stuff when he was born. And some of you know what I'm talking about. Some of you just have a tendency, if you know it's going to go to your lungs, if you're going to catch something, it's going to go to your lungs. If you're that person, you really want to have a lot of these oils and tools around you so that you can really be proactive and start treating this right away. As soon as you feel like something's coming in, start treating your lungs. Give them the love that they need to be able to support you in the process of living. So constitutional hydrotherapy is when you wrap your kid up in sheets and blankets, kind of like a burrito, and then you alternate hot towels. You put a hot towel on their chest for 5 minutes, and then another hot towel on their chest for 5 minutes, and then a cool towel on their chest until they warm it up to room temperature. And you put the hot towel and you put the dry blankets on top of them, then you take it off, put a second hot towel, and then you put on the cold wet towel wrung out really well until their body warms it up. I did this on my kids who were really sick, and it was always a thing that would just really help them move to this next level of health. And we would do it every day, and it's a super, super, super sweet, cozy time with your kids. So I would lie down and we would read books with them, like while we're waiting for the towel to warm up, and my kids actually would look forward to it and ask for this treatment. Can I have a constitutional, Mom? Afterwards, I would work on their spine and do tapping down the spine. This really activates the nervous system and the nerves that go to the lung area. It also is where the parasympathetic nerves really come out on the thoracic spine, which can be calming because it can be really aggravating to have such a bad cough and to be sick. So I just tap my fingers down their spine like this. Now, what I suggest is that you put some oils on your fingertips while you're doing this. So you can put the breathe oil, or a really nice combination would be thyme and lemon and frankincense and lavender, and make that your lovely spine oil. And you just put that down on the spine, and then just do tapping all the way down the spine, maybe about 5 times, just tapping, 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 tapping all the way down the spine. Feels great. It's really supportive, and those oils will go in through the spine and go into the circulation and really help support their immune system. So there are lots of other formulas that you can put together to help your body with recovering from coughs during this time. And I'm really happy to answer any questions. So maybe ask any questions now, or if you're listening to this later and you have questions, go ahead and post them. I know a lot of you are home sick with people that are sick, or you yourself is sick, and I'm really happy to support you. And I can be checking out on Facebook Live to answer your questions. I will create a little PDF for you guys next week with some of the tips that I've listed out today. And a couple other things I just want to make sure I mention. One is, of course, diet is super important. So some of the foods that can decrease your chance of getting well are eating fried foods, coffee, sugar, dairy. Those are too mucus producing and too toxic for your body when you're sick. So make sure you're on a super clean diet, you're eating really well, drinking lots of water, and don't forget to attend to the emotional part of your being. It's really easy to feel funky when you're feeling sick, like I said. So make sure that you're addressing that part too. The lungs can be associated with grief. So if you have some unresolved grief to go through, maybe this is a time to support yourself with some of the emotional oils. So please let me know if you have any questions. If you are interested, I have a little PDF out there on some great holiday recipes. You'll see me in a red shirt talking, and go ahead and click on that link and you'll get a really wonderful recipe PDF. I hope you'll join us in our cleanse. We're doing a clean slate cleanse starting in the middle of January. This is a great reboot for your immune system, so please come join us. It's really great for detoxification, getting your gut healthy, which helps your immune system. And just please remember to love yourself. I really hope this has been helpful for you. My whole reason for being here is to just help other people learn how to empower themselves to take care of yourself. And you have in your hands these essential oils, the most amazing, powerful tools to self-help, to heal yourself and those around you. So please use them, enjoy them. And we are all so grateful that we have these for our use. So thank you so much. With Jenny Tufenkian here with a reminder to love. Take care.